Now, there is no need to suffer with debilitating joint pain or chronic pain any longer. There's a new procedure that is extremely effective, and here with all the details is Dr. Cecil Graham from AZ Pain Centers. It's good to see you, Dr. Graham.
Hi, Lisa. Good to be back.
You know, we were joking earlier about joint pain, or I was joking, going, oh, isn't it just the places where you bend? Thinking, and you're like, no, there's a lot of joints in our body that we don't really think of.
Well, actually, joint is a space where two bones come together. So, for instance, in your hands, you've got over 20 joints. But the most common joint that we actually inject at the pain clinic is the sacroiliac joint, which is just where the iliac crest of the pelvis and the bottom of the sacrum come together. So, but that is technically a joint.
Yeah, and it seems like that area a lot of people have pain with.
It's extremely common.
Why is that? Just is the age?
Just the mechanism. Part of it is in a fixed area, and then when you're contracting your musculature and you're bending and you're lifting in one direction, and then all of a sudden something shifts in a different plane, you create a shearing force, place a lot of pressure on that joint space, and then your body responds with an inflammatory reaction.
And that's when people start taking all that over-the-counter stuff that you hear about.
Everything.
Yeah, everything under the sun. So what can you do for that kind of pain? And is it obvious that you have that kind of pain?
Oh, sure.
Okay.
Yeah.
It doesn't mask itself in like a muscle pain or something. You know it's a joint issue.
When you think about causes of pain, it's staggering, but there's listed 731 causes of joint pain.
Huh.
And one of the things we learn in medical school is when you hear hoofbeats, you look for horses, not zebras. So of those 731 causes of joint pain, there's probably 20 of them that are very, very common. Osteoarthritis and just acute joint injury from a sprain or something like that. So, but you have to narrow it down and define what the cause is. But most often what we see is osteoarthritis and injuries from disc protrusions and that kind of thing.
And what can you do to treat those areas for people who are suffering and nothing seems to be working for them?
Well, one of the things we do is we obviously, if it's an isolated joint, for instance, knees, hips, elbows, we can inject right into the joint, and we do that. And one of the things that we do differently is we use a non-steroidal substance that suppresses the inflammatory response. A lot of people will do steroid injections into joint spaces, but one of the major side effects of steroids is bony erosion over time if you repeat the injection. So you're actually adding to the disease process by overusing steroid substances directly into the joint space.
Will people get results right away when they get an injection?
Oh, absolutely. I mean, it's pretty instantaneous. It's a combination. Obviously, when we inject, there's a couple of local anesthetics that give immediate relief, and then the non-steroidal anti-inflammatory substance takes anywhere from 12 to 24 hours to start having some effect, and then gradually peaks over the next 72 hours.
Do you need to come to you with like x-rays, MRIs, whatever, saying, here, I actually have this? Or can you just come to you and go, all I know is I got pain right here, and it's been bothering me for months?
Either way.
Okay.
We see all extents of the spectrum. When someone calls and they set up an appointment, our people ask if they have any previous studies, and we'd like to see those. We bring those. But then when we do our initial evaluation, of course, if we need to do an MRI, whatever, just like anyone else, we want to try to get to the bottom of it and find the cause if possible.
So can you treat any area of the body, no matter where the joint pain might be?
We do, and one of the most important things, another real interesting issue is that a lot of joint pain is referred. For instance, if you have, you've got the brain, the spinal cord, and then each level the nerve roots come out. So if you have a disc or a bony prominence, a layman's term, a spur, hitting a nerve root, then anywhere in the distribution of that nerve root you can perceive pain. Another very common thing we see is people presenting with lateral hip pain. And they'll think, oh, I need a hip replacement or this or that.
Right.
At the thoracolumbar junction, which is your 12 thoracic vertebral bodies, all have ribs attached to them, so they're very stable. And where the transition from the thoracic to the lumbar area, it's very common to get strain at that area, and you'll have one nerve root that goes down to the SI joint that I was telling you.
Yeah.
Another one goes to the lateral hip,
Right.
And another one comes around to the front of the groin in the pelvis. So quite frequently we'll have patients with lateral hip pain. We'll do an injection at the thoracolumbar junction, and and you're like a hero.
Yeah, that's awesome. And I know folks are listening around and go, that's me, that's me, that's me. I need to get this fixed. So there is a way you go right to the source of where the pain is coming from. So thank you, Dr. Graham, for explaining all that, because I know a lot of people do suffer with this. So if you want more information on AZ Pain Centers, go to azpaincenters.com. There is their phone number, and give them a call so you can get out of that pain today.